We're here at Leyton Riding Centre in Leyton, in London. The Equine Health and Welfare Strategy came about because the government produced an animal welfare, health and welfare strategy. This was not specific to horses. It covered guinea pigs and rabbits and sheep and pigs and cattle. And the industry decided that we needed a species-specific sub-strategy to deal specifically with the horse. Over the next 10 years, we hope to make everything for horses' health and welfare better. We want to have better information available for horse owners and keepers. We want to have better ways for people to report cases of ill treatment. We want to look at medicines and see what effect they have and how we can improve access to them. And so it goes on, as with all the 7 main aims of the strategy.
There's been a huge cross-section of people here today. There have been the people who have made the stands and the activities for people to be involved with, and they are mainly the welfare organisations, British Equine Veterinary Association, the farriery, the Worshipful Company of Farriers, the Worshipful Company of Lauriners, and the saddlers as well. And we invited all those people to come in to try and provide a range of activities for people to illustrate the aims or the design of the Equine Health and Welfare Strategy. So we're cutting across the main preventive care elements that we can look at to make a horse's life comfortable and to keep them healthy as well. And as well as inviting the people to put on the demonstrations or the activities, we have invited a lot of school children here with their teachers. We've invited other organisations to come and take part, and we have media here as well.
Today we've had 120 plus school children from the East End of London. Most of them have never seen a real live horse before. Some of them have, but most of them haven't. It's important for the strategy that we did this public launch here today for 2 reasons. One, the children are our horse owners of the future. Just because they're East End children and they don't have access to horses now, it doesn't mean that they're not going to ride horses in the future. We need to educate all children.
Today is all about putting the right food in. If we put the right food into horses, we get the results out.
And the second reason that we're here today is because Lee Valley Riding Centre is a small green oasis in a very industrial part of London. And when you come down the drive that's lined with beautiful chestnut trees, you really don't believe that this riding school has been here for 40 years. They're very keen and they work very hard with the riding for the disabled, and moreover they bring in children and adults for have-a-go lessons that have never had a chance to access horses before. And therefore it was important to us that we come to somewhere that has already bought into passing on good education and good riding instruction to children, and we wanted to support that, and it is a super place for us to have come.
BEVA, the British Equine Veterinary Association, has been involved with the Equine Health and Welfare Strategy right from the start. We've been one of the organisations involved with drafting of the strategy. The vision is very simple, and the essence of it is that all horses should be properly treated, and all those people involved with looking after and riding horses understand their responsibilities towards the horse. So that's the overall vision, but as you say, the challenge is converting that into a plan that will actually make a difference on the ground. And so to do that, us and the organisations who are involved with writing this broke down this very large task into 8 aims, and each aim deals with a key point in the business of keeping our horses, ponies and donkeys healthy. You can't really set about this unless you know where we're at the moment. And so one of the aims of the strategy is to define precisely where we're at with horse health and welfare in 2007. And that really will define the baseline for where we go from here. And this is not just about the standards that which people work to when they're keeping and using their horse, but it's also about health standards as well. And for example, one of the aims that BEVA has responsibility for is defining the current health status of the UK horse population. Just how often do horses go lame? Just how often do they get colic? How often do they cough and so on? And it's only by having that baseline that we can say, okay, well, these are the standards that we expect people to work to, and then measure whether the strategy has actually had an effect. All vets have a key role in the strategy, because the horse owning and using public need to understand what's meant by duty of care and what the kind of general standards of welfare are that are expected, and what they should be doing with preventive medicine and so on. And delivery of that falls absolutely squarely to equine vets. And so it's our members out there in practice who are responsible for actually making this work with horse owners.
Can I tell you a little bit more about some of the activities that have been going on here today? We've had children here from 2 different schools today, and they've had the opportunity to meet and pat a pony. We have 2 donkeys in the arena too, and they've had a chance to meet those and learn the differences between donkeys and ponies. The International League for the Protection of Horses bought a weighbridge, and this has been a great success. They're running a right weight campaign, and the idea behind it is that the horses are weighed on the weighbridge, and then a nutritionist looks over the horse and decides whether or not it's overweight and which particular areas of its body are overweight. They've had the opportunity to see how dentistry is carried out on a horse, and we have a mechanical horse here too, and for those that have never ridden a horse, it's quite a safe way for them to have their first ride by sitting on a mechanical horse. As far as the equine health and welfare strategy is concerned, we hope that today the children will take away with them the fact that when we look after our horses and our ponies, we look at their feeding, and we need to consider their weight, and this can be linked to their own feeding and their own weight, and really we've linked it into childhood obesity, which of course is a key thing in the press at the moment. Anyone wanting to know more about horse health and welfare in this country should ask one of the equine welfare charities. They can approach their vet to find out more, and of course we will be updating everyone on the progress of the strategy over the next 10 years with regular updates on our own website www.equinehealthandwelfarestrategy.co.uk.